Essential understanding of hematology. This movie is about anemia. The theme of this issue is anemia. Since it's a quick overview, I'll just give a general idea of what anemia is. Let's start by going over red blood cells again so we can better understand anemia. You know how when we talk about the weight of blood components, it's like 96% red blood cells, 3% white blood cells, and 1% platelets. Most of it is made up of red blood cells. That's why blood looks red. Red blood cells' job is to carry oxygen around. They grab oxygen from your lungs, hop into the bloodstream, and travel all over, making sure every part of your body gets some. Let's get a rough idea of how red blood cells are made. First off, red blood cells are created in the bone marrow. That's like the body's blood cell factory. To build hemoglobin, the stuff inside red blood cells that carries oxygen, your body needs iron. No iron, no hemoglobin. Also, your kidneys help out by releasing a hormone called erythropoietin, or EPO for short. That hormone tells the bone marrow, hey, let's make more red blood cells. Once the red blood cells are made, they leave the bone marrow, enter your blood vessels, and start circulating throughout your whole body. They do their job for about 120 days, and when they're old and worn out, they pass through the spleen, where they get broken down and recycled. Anemia is a condition where there are not enough red blood cells to supply the body with the needed oxygen. The WHO has set guidelines for what counts as anemia based on hemoglobin levels. Just a heads up, those levels aren't one size fits all. The definition of anemia actually changes depending on things like your age and gender. So, anemia is usually defined by hemoglobin levels, but honestly, the amount of oxygen each person needs is totally different. How many red blood cells you actually need to get enough oxygen depends on all kinds of stuff, like your age, how active you are, where you live, especially if it's high up in the mountains, how well your heart and lungs work, and even whether you're pregnant. And just because your hemoglobin levels are on the lower side doesn't always mean you don't have enough red blood cells to do the job. The symptoms of anemia include shortness of breath, extreme fatigue, general tiredness, heart palpitations, headaches, and even fainting. Think of it like this: when you sprint up a flight of stairs, you get out of breath, right? That happens because your body suddenly needs a ton of oxygen, and your red blood cells can't keep up with transporting enough of it. Now, imagine if you didn't even sprint, just moved around a little, and your body still struggled to get enough oxygen. That's what happens when someone is anemic. There aren't enough red blood cells to deliver the oxygen your body needs, so even small movements can make you feel totally wiped out. Anemia is when you don't have enough red blood cells, so there's less oxygen being carried around your body. When your red blood cell count drops, the amount of oxygen they can carry decreases. If your body needs more oxygen than what's being delivered, it won't be able to get enough to where it's needed. If you have anemia but you're just chilling and sitting around most of the time, your body doesn't need a ton of oxygen. So even if your red blood cell count is low, you might not actually feel short on oxygen. When your activity level ramps up to something like running up a flight of stairs, your body needs a lot more oxygen. If you don't have enough red blood cells, it can lead to a shortage of oxygen, which might cause symptoms like shortness of breath during effort, getting tired easily, feeling drained, a racing heart, headaches, or even fainting. The symptoms of anemia aren't just determined by hemoglobin levels, they're also heavily influenced by how quickly the anemia develops. When anemia progresses rapidly, symptoms are much more likely to show up. On the other hand, if it develops slowly, symptoms might not appear as easily. This all comes down to whether or not the body has time to adjust to the state of anemia. To make it easier to understand, think about when you go to a high-altitude place, like during mountain climbing. For example, people who have lived at high altitudes for a long time are used to the low oxygen levels there. But if you suddenly go to a high-altitude location, your body doesn't have time to adapt, and you might experience symptoms like shortness of breath during physical activity, fatigue, exhaustion, heart palpitations, or even headaches. Hemoglobin levels are a super common way to check how bad anemia might be. Basically, it shows how many grams of hemoglobin are in 1 deciliter of blood. But hey, just a heads up, when you're looking at hemoglobin levels to figure out if it's anemia, there are a few things you've got to watch out for. The orange juice on the right is 100%. Now, if you take a sip of that 100% orange juice, what percentage is the orange juice left in the glass on the left? It's still 100%. Drinking it doesn't change the concentration. Drinking 100% orange juice doesn't suddenly make the remaining juice weaker or less flavorful, right? So basically, just because the amount goes down doesn't mean the concentration changes. Okay, let's break this down in a chill, easy-to-get way. So, say someone has a hemoglobin level of 14.0, and they lose 30% of their blood all at once. If you took their blood right after the bleeding, but before any fluids were given, the hemoglobin would still show as 14.0. Kinda wild, right? It's just like 100% orange juice. You could pour some out of the bottle, but the stuff that's left is still the same concentration. Hemoglobin is a concentration too, not a total amount, so just losing blood doesn't instantly change that number. Gotta be careful with that. Now, if they get 4 fluids afterward and their blood gets diluted, then the hemoglobin level might drop, like to around 9.8 or so in this case. That's when you'll see the number change. So yeah, timing really matters when checking hemoglobin after bleeding. Alrighty, let's move on to the different types of anemia. There's actually a bunch of kinds, depending on what's causing it, so it's not just one thing across the board. Let's dive into that. Anemia happens when something goes wrong in the process of making red blood cells. For example, if the bone marrow where red blood cells are made isn't working right, that can cause anemia. This can happen with things like acute leukemia, myelodysplastic syndromes, aplastic anemia, or if cancer spreads to the bone marrow. Now, to make hemoglobin, that super important part of red blood cells, your body needs iron. If there's not enough iron, you can't make hemoglobin properly, and red blood cell production drops. That's what we call iron deficiency anemia. Iron's mainly stored in your liver, but here's the catch. When there's inflammation in the body, the liver holds on to the iron and doesn't let it out. So even if you've got iron, your body can't use it, and that leads to anemia of chronic inflammation. There's also a hormone called erythropoietin that's made in your kidneys. It tells your body to make more red blood cells. If your kidneys aren't making enough of it, like in kidney disease, that can cause renal anemia. Once red blood cells are made in the bone marrow, they enter the bloodstream and travel all around the body. They usually live for about 120 days. After that, they get broken down in the spleen. But sometimes, red blood cells break down too soon. That's called hemolytic anemia. It can happen in conditions like thalassemia, hereditary spherocytosis, autoimmune hemolytic anemia, paroxysmal nocturnal hemoglobinuria, microangiopathic hemolytic anemia like DIC or TTP, erythrocyte crush syndrome. Also, if too much blood is flowing into the spleen, it might start breaking down red blood cells more than it should. That's called hypersplenism. Oh, and if you're curious about how blood cells are made in general, there's a video we made earlier about hematopoiesis. The link's down in the video description, so feel free to check it out. Take-home messages. The appearance of anemia symptoms depends on factors like hemoglobin levels, activity levels, and how quickly the anemia progresses. Hemoglobin concentration refers to the concentration. Even if there's a lot of blood loss, it doesn't drop immediately.